If you've ever walked into a medical office, aesthetics clinic, tattoo studio, or doctor's office, you've probably smelled isopropyl alcohol. What exactly does this bottle do? Is it good for the skin? Does it kill acne? Should you use it every day? Today, I'm breaking down the science behind 70% isopropyl alcohol and what organisms it targets and where it actually belongs in the professional skincare realm. Isopropyl alcohol, also called rubbing alcohol, is an antiseptic. Its job isn't to nourish the skin. Its job is to reduce microorganisms living on the surface before treatments or procedures. Now, an interesting fact, 70% works better than 90% or 99% for disinfecting the skin. And why? Because water slows evaporation and helps the alcohol penetrate microbial cell walls more effectively. This is why hospitals, clinics, and aesthetic practices commonly use 70%. Isopropyl alcohol is effective against many common microorganisms, including most bacteria, many viruses that have an outer lipid envelope, and then some fungi and yeast. It honestly works by breaking apart the cell membranes and then dissolving fats within microorganisms. This causing microorganisms to lose structure and die. This happens within seconds and when enough contact time is allowed. Why am I all in? Our skin naturally contains oils, sweats, healthy bacteria, lipids that form the protective skin barrier. And when you apply this alcohol, it quickly dissolves oil on the surface. That makes skin temporarily feel clean. But repeated use also removes the protective lipids that keep moisture inside the skin. And without those lipids, water escapes faster, dryness develops, irritation may occur, increased tiny cracks can appear, the skin barrier becomes weaker. This is why frequent use can leave skin feeling tight or flaky. The biggest misconception is that it helps acne. It does help acne to a certain extent. It can temporarily reduce bacteria sitting on the surface, but acne isn't just caused by bacteria. Acne involves excess oil, we have dead skin cell buildup, inflammation, hormonal changes, and because alcohol strips the skin so aggressively, your skin may actually compensate by producing more oil afterwards. So for many people, that creates an ongoing cycle of dryness, followed by increased oiliness, and so forth and so on. In aesthetics and medical setting, isopropyl alcohol is used for specific uses. We prepare the intact skin before injections. We clean the skin before certain procedures, sanitizing equipment when appropriate, and removing oil from specific treatment areas when indicated. It's used because reducing microorganisms lowers the risk of introducing bacteria during procedures. When should you use this bad boy? Avoid using this if you have an open wound, unless directed by a healthcare professional. Don't use it while you're on eczema, sunburned skin, after a chemical peel, and after microneedling, after laser treatments, or on compromised skin barriers. These situations require products that support healing, not ingredients that further dry the tissue. This is a great antiseptic. It's not a moisturizer, it's not an anti-aging ingredient, and it isn't meant to be part of our everyday skincare routine. Its strength literally lies in reducing microorganisms before procedures and treatments, not improving the health of the skin over time. Here's something many people don't know. One of the reasons some people wipe their underarms with 70% isopropyl alcohol, it's because the body odor isn't caused by sweat itself. Fresh sweat literally is actually just odorless. So the smell develops when naturally occurring bacteria on your skin breaks down proteins and lipids in your sweat. That's what creates the odor-causing compound. And since isopropyl alcohol rapidly reduces the many of those bacteria, it can temporarily honestly reduce body odor. So that's why some people use a small amount on clean, intact underarms before applying deodorant, or they just eliminate the deodorant and occasionally use this in place of deodorant. However, there are a few things you should know. Isopropyl alcohol does not stop sweating, and unlike many other deodorants, it won't block your sweat glands. It only helps reducing odor by lowering the number of odor-producing bacteria on the skin. So because of this alcohol, it also removes the skin's natural oils. Using it every day can dry the delicate underarm area and cause irritation, or can lead to burning, especially right after shaving or waxing. If you choose to use it, apply only a small amount to healthy, unbroken skin. Allow it to dry completely and discontinue if any irritation develops. For most people, a deodorant designed for daily use is gentler on the skin while providing longer lasting odor control. But in a jiffy, go right ahead. It works. So don't or do, it's up to you. What separates you from either being a professional or a myth buster. If you enjoy learning the science behind this product used in aesthetics and medical aesthetics, go right ahead. And I'm going to be breaking down usual key ingredients that you find at the comfort of your own home, especially during this triple-digit month. We don't want anybody sweating out there, do we now? Or smelling like sweat. Just be kind to your neighbor. Bye.